in the United States alone, there's more than 500,000 strokes occurring every year. And I think that number is just mind-boggling, because the implications of stroke are so great that we really have to work as a team. Patients with doctors, patients with nurses, patients with hospitals. We have to work together to try to lower the number and the impact of strokes. And the reality is that within these blood vessels, there's fat, cholesterol, and a process called neointimal hyperplasia. It leads to narrowing of the blood vessels, but more importantly, there's fatty plaques that exist within blood vessels. It's this substrate which often can rupture, and then the platelets go and stick to the area where there's plaque rupture, and that occludes the blood vessel and triggers a heart attack or the stroke. I'm expected to arrive to the hospital, and within 90 minutes of them walking into the emergency room, I'm expected to do the heart cath, open up the blood vessel with an angioplasty, followed by placement of a stent. And the reality is that we're quite successful with that. It's more difficult in the neurological arena because often there's not a neuroradiologist to do that type of intervention. At least in the stroke arena is a thrombolytic therapy, and I'm sure you all have heard a lot about that. Basically, thrombolytic therapy is a medication given through an IV, and that dissolves the blood clot. And it's really the keystone treatment for an acute stroke. So I'm very happy to see that both hospitals are working diligently to move faster to treat the patients. Right now, I estimate it's probably about 15% of patients, maybe 20, that come in with a stroke and that can actually qualify and receive the treatment. It is a risky treatment. There is some finite risk. You can get complications from the treatment, but the benefits are even greater. Pretty well as a simple carotid ultrasound, and it can diagnose any significant blockage to the brain that occurs in the carotid arteries. So there's a lot of miniature strokes that occur without even knowing. And then if you look at the patients that got blood pressure treatment with hypertension, the stroke rate was like 5%. So it's obvious that if you intervene on the high blood pressure portion, that you will get good results in terms of reducing strokes. That we have to identify the patients that have atrial fibrillation and have the conversation about anticoagulation. Because if we're not doing that, I think that we're failing these patients. The importance of working with your physicians and your nurses and your nurse practitioners is essential so that you get the best care possible.
Dr. Sinadra, what about people that are basically healthy? I had read if you were over 50 years old and you were generally basically healthy, you didn't have a bleeding ulcer, that you could take a baby aspirin a day to prevent a stroke. Is that true?
I think that there's a lot of efficacy towards that, and it prevents heart attacks, strokes, and they even say colon cancer. And the reality is that aspirin's good, and there's also a significant percentage of people who, if you find other risk factors like atrial fibrillation, it's not going to work. That you need stronger blood thinners. But for the general population, if they can tolerate a baby aspirin a day, I think it's a good idea. I know I take one every day.
I want to ask you, how is it possible that you can get another stroke?
I think that with heart attacks and strokes that people have to be more vigilant and treat their risk factors. Yeah. And if they don't, there's always a chance of having another stroke.
I'll introduce myself. I'm Faye Maynard. I'm the Executive Director of Ruthby Cal, and I'm sure all of you have heard of Ruthby Cal through the years. It's been there over 50 years. We were able to buy the, it's called an AlterG anti-gravity treadmill. Everybody says, well, what is it? It looks kind of space age, and it is. Some of the materials on it actually are. But this particular piece of equipment gives you the same type of therapy you would have as if you were in the water. So we have a piece of lift. We have the lift equipment. If you're having trouble getting in it, we can help you in it. You wear these really strange little shorts that have a zipper all the way around, and we zip you in, and then we weigh you, and we blow it up. This section here where you see all the air, we blow it up, and the machine weighs you 3 times. And after the 3rd time, it calibrates your weight. And once it calibrates your weight, then based on whatever the doctor and the therapist have as your plan of care, we start reducing the weight on your joint. Say, for instance, you had an ankle or a knee. we would start reducing the weight on your knee and your ankle until you had no pain. We have camera equipment, and Bill can attest to this. He got in the machine, we started up, well, how much weight did they take off your joint?
About
30%? And then he could look in the camera, we could place those cameras strategically around the machine, so we can target whatever area the doctor's interested in.
Train his son Billy to kind of get him ready to start playing basketball for high school. And that's when, Bill and I met. He was saying it's about 7 years already that we've been working at it, and still every day is a struggle, every day is a hard workout, and little screams and shouts every once in a while from the stretching, but it's something that has to be done. So,
what do you have in store for me?
today we're going to go over a couple of just little simple stretches that Bill and I do, and things that just kind of help loosen up his right arm. Okay, well, a lot of times Bill's hand kind of comes in and gets real tight. If he yawns, it'll get real tight. So we just usually start with the fingertips and spread it down here, and then I'll kind of spread his fingers here.
Does that hurt, Bill?
Nah.
For his fingers to stretch, his most of the muscles and tendons in here, which really tightens up.
It gets good after a while.
Yeah, at the end of the workout, he's nice and limber and stuff like that. It's in the beginning when everything's real tight.